Alrighty. So, you can see this okay?
Mhm.
The first slide? Okay. Let me go ahead and do full screen. Is that still working?
Yeah, all
Okay.
good.
Okay, good. Good.
So I could read the starting housekeeping information.
Be my guest.
So welcome everyone. So we do have questions from email we will use. You can put your questions into the chat for if you do have a question anytime during the session. We do plan on answering all of your questions, so no matter how long it takes. We'll see if there are common threads to questions. For instance, when the same question is being asked by several people, these questions have first priority. And feel free to raise your hand if you aren't understanding what Doc Rob is saying. We definitely want everyone to learn and benefit from this time together.
And my disclaimer, I want to be able to help everyone, but I'm limited in my ability to give the perfect answer to your question because we don't have a doctor-patient relationship. And that is created when I'm actually there physically examining your pet. Telemedicine in the veterinary realm is not quite as well established as in the human realm because our patients don't really talk to us. So we really need to have that physical contact at least once or twice to have a good sense of who we're treating. I don't have your pet's history or copies of diagnostic tests, so I'll do the best I can to answer your questions about your pets. But please understand, I'm not giving you medical advice. I'm basically giving you education so you can better understand the situation. But and we may need to follow up later, later conversation. So these monthly live Q&As, we've been doing them now. This is I think the ninth one, which
Mhm.
is really pretty cool. And we're getting more and more people interested in coming. We try to do them the fourth Thursday of each month, but this is the first Thursday of this month because we had the Thanksgiving holiday to contend with for the fourth Thursday of last month. And we are recording them live. And if you have registered for this, which would mean that you're actually viewing it now, then you will be sent an email that will have a link for the recording. And the recordings are all on my YouTube channel anyway, aren't they, Haley? So, and if you want to look at past recordings, you can also go up there and there's a lot more than just these up there. Working on that. I'm kind of new to the whole online stuff. I'm getting better at it. Um, I've written a book called There's a Mushroom for That, and it's basically a reference text for these live events and any kind of ongoing health mentoring I might be doing with your animals. And if you don't already have the book, it's a great book, if I do say so myself, and you can order it through Amazon. And if you wanted to, if you did that, you could send us our receipt. We can also send you a discount coupon for of 25% for two times for anything on our website. And we're thinking about expanding this into health mentoring, into webinars with information and education. Everybody has only so much time available in their lives, me especially, but I really like doing these things. And so, reach out to us and let us know your thoughts as far as where you might like to see us go. And we're definitely going to listen to you there. So tonight, our topic is called lumps and bumps, and we're using that terminology because the FDA doesn't like you to use the word cancer, especially if it's being spread, on the internet. They have a bunch of people that are continually looking at searching for words like cancer on the internet to find people who may be making inappropriate medical claims about things. And we're going to talk about what are lumps and bumps, and are they cancerous? What is cancer? How does benign or malignant mean? How can you tell if the lump is a problem? And what if the lump is actually internal? Then what? Those are questions I plan on answering. Um, and so let's get started with working on those questions. I think I'm going to go back here and so yeah, lumps and bumps. When we talk about lumps and bumps, we're more talking about, superficial tumors, cancerous lumps or bumps that we see. And are they cancerous? And I think there's some confusion about the word cancer and what what people mean by that, because some people think that cancer means it has to be something that's malignant and is very toxic. But cancer takes a number of different forms, and we can have cancers that are benign that you can live your whole life with that will be not a problem. So that's kind of what we're talking about, is all of these growths, whether they be benign or malignant or just slow moving or early going on. And what is cancer? Cancer is when a cell, normally cells have these normal breaks that they have that put the brakes on their reproduction. When cells divide, they don't divide a lot. They divide just enough to provide more cells to the healthy tissue. But with cancer, we wind up, when a cell becomes cancerous, there are um, mutations that occur in aspects of the DNA and in aspects of its cellular function that don't put the brakes on the division of cells. And so you get this uncontrolled division of cells that goes way beyond what the local tissue needs. And that's where it keeps dividing and then forms into these lumps. I'm fond of saying that, and kind of in a humorous way, that cancer is kind of like juvenile delinquents. They're young and they just keep dividing and they mess up the neighborhood. As compared to growing old and dying, they don't. The aging process in cancer cells is absent. So they don't age, they just keep dividing and dividing. And by their dividing process, they invade tissue, they can spread to other parts of the body, and that's how they do their damage. And ultimately, that's how they kill people or kill animals. They may go to the heart, affect the heart flow. They may go to the liver and affect how the liver detoxifies and works with the metabolism. They may go to the brain, or they may arise locally in these organs and cause damage by their growth in those organs. Even a benign tumor, that benign means that it grows, but it doesn't grow it grows uncontrollably, but in a more controlled fashion. And benign tumors don't spread, but if a benign tumor is in a location in the body that is kind of a closed cell, like let's say you have a benign tumor in the brain, but it keeps growing, and because the brain is enclosed in this hard skull, then as the tumor grows, it pushes out healthy tissue and can cause damage that way, even without spreading. We can see lipomas, which are fatty tumors, growing very large, like around joints and things, to the extent that they can actually affect the joint movement, or they could be in other parts of the body where they could cause damage, even though they are benign. So that's what we really mean when we talk about cancer and whether the cancer is benign or malignant. Malignant obviously is a much more rapid process, and oftentimes, as it goes on, involves several different organs, several different tissues. Um, how can you tell if the lump is a problem? And that is a good question, because when a lump is small, it may not be interfering with many things, but it depends on where it's located, and it depends on its rate of growth, and also on its what we call its aggressiveness or its malignancy. And we can judge malignancy in a tumor by, when we look at it under the microscope, we can look at the actual cells dividing, and we can count the number of cells that are actively dividing. They call that the mitotic index, which means basically how many cells are you seeing that are dividing. And by looking at how many cells are dividing in a microscopic field, we wind up having an index that allows us to say, wow, that's really a lot of cells that are actively dividing at that moment in time. And that means that it's a much more aggressive tumor as compared to one that might only have a very few cells, where we could only see the chromosomes, dividing apart in only a few cells there. Um, and the nice thing about lumps and bumps that occur on the skin is that we have access to them. They're easy to get to. We can biopsy them, or we can aspirate them to find out what they are more precisely. Biopsy usually means we take a little piece of it And then we send that into the pathology lab where they then do a section and they can look at it under the microscope and tell you very precisely what it is. Or we do an aspirate where we stick like a little teeny needle into it, and the needle winds up, and the cells from that lump wind up. Some of them go inside the inside the needle. We can then spray those cells out onto a slide and stain them, and we can look at them locally, like right then and there while you're at the veterinary office in the exam room. We can look at them, and we don't have as much information from aspirate as we do from a biopsy, but it can give us an awful lot of information still that's really quick and easy. And of course, if it's an external lump, then it's oftentimes fairly easy to remove, depending on, how progressed it has gotten. And so that's also something that when that the best outcomes with cancer are to is to detect it early and to intervene early versus letting it progress and get big and get involved in other tissues. Makes it a lot harder to surgically remove it, or it makes a lot harder to treat it with conventional therapies like chemotherapy or radiation, or um, or alternative therapies. And even with alternative therapies, if you've got a big mass, that's a lot of mass that we have that we're asking these supplements to do something about. So the best success we see with conventional therapy and with alternative therapy is when we get on top of it early and deal with it as soon as we can, because as it progresses, it spreads out and gets much more difficult to treat, and much more difficult to treat. So the next slide is, what do we do? Well, statistically, most of the lumps you see on your dog are not cancerous or malignant. We probably the most common lump are these lipomas, which are for these fatty tumors that you can see on the dog's back or on the belly. They feel almost like little jellyfish underneath, or jello underneath the skin. They move around very easily. And most of them are benign. Most of them don't cause any problem at all, but if they're in an area that can cause a problem, then they are a problem. Sometimes they turn malignant, and they can be pretty nasty when they're malignant. Um, Mast cell tumors, we've got three grades for mast cell tumors, and the first two grades, um, they don't spread. They're not malignant. They just arise and could be a local problem. My observation is that dogs who have chronic allergies oftentimes are most likely to develop mast cell tumors, because mast cells are the cells of the allergic system. They're the ones that react and release histamine. Um, and so when you have allergies, and so they divide rapidly in the allergic animal, and that gives them a greater opportunity to develop a mutation and become cancerous. So most of them don't even need to be removed, but you have to get a piece of it in order to send it into the lab, in order for them to be able to grade it to find out, is it a good one, or is it maybe not such a good one. And then we have other things. We've got warts, we've got cysts. We've got things like pustules, which are basically like abscesses, but oftentimes they're not infectious. We can get them; they're inflammatory pustules, and you squeeze them, and you get this thick pus out of them, almost like a yogurt or something. And granulomas, which are made up of fibrous tissue, connective tissue, oftentimes can happen from the dog licking or from constant irritation in an area. And these can be removed. They're not cancerous. And you might want to remove them if they're causing a problem. Sometimes warts can grow to the extent that they start bleeding, or the dog might develop a little bit of a bacterial infection, and so the dog would irritate. It would irritate the dog, and they'd scratch at it, and then it would start bleeding. So removing warts surgically might be a good idea. Oftentimes, warts are caused by a virus, the papilloma virus, and I've had some success treating that with antiviral herbs and mushrooms without doing surgery. So what do you do about it? Well, the plan of action, it depends upon the diagnosis of the lump as being non-cancerous, benign, or malignant, and where it's located. And of course, the age of the animal, if surgery is something that we might want to do, is suitable for surgery. And to determine that, we would need to make sure liver function, kidney function, heart and lung function are good. Um, you know, eh, where is the location of it? What is the type of cancer? Is it so fast moving that maybe, at this point that we jump in and find it, it's too late almost to do anything. So it's very individual. There's not one plan of action that you want to do. And hopefully you'll have a veterinarian that you have confidence in who can kind of look at the big picture and help you to make that decision because it's really your decision to make. Um, Lumps that are malignant oftentimes have irregular borders. They can be firmly attached to underlying tissue. Oftentimes they're reddened. They can be not warm, but warm to the touch. They can be even uncomfortable to touch. And they may grow rather rapidly as compared to benign tumors that oftentimes have very regular margins and oftentimes just don't grow very rapidly at all or grow much at all once they arise and get there. They oftentimes are loose and not connected to the underlying tissue. Well, that's not always a hallmark of it. Um, and they oftentimes aren't warm to the touch. So one thing that you can do early on is you can actually, observe it, make notes of it. You can measure it with a ruler to see what the rate of growth is. You can, and you can call your vet and tell them these are your observations. They'll probably want you to come in so they can take a look at it themselves. Many vets get to see a lot of different lumps and learn over the years, almost not necessarily to diagnose it, but they get a good feeling about when they can look at an external lump, how dangerous it is or how important it is to do something about that. Um, and the veterinarian, like I said, we can minimally invasively aspirate the lump. That's probably the simplest thing to do. It doesn't involve anesthesia. It's not painful. The animal doesn't even know that that little needle's going in. And we can look at it right there under the microscope. And if we have questions about what it is, we can take that slide and we can send it to the lab and have an experienced pathologist read it for us. Now, there's always a fee associated with that, but that increases the accuracy of your diagnosis when you make that aspirate. So, aspirates typically don't contribute to the spread of cancer cells, and in fact, neither do biopsies, but occasionally a biopsy can. I think there's a bit of an urban myth about biopsies that they can spread. Depends on where the tumor is and how the biopsy is being done. But I think biopsies are extremely valuable in terms of telling us very precisely what kind of cancer it is, which allows us to better plan and measure our steps in terms of treating it or not treating it or exactly what we're going to do. So let's see what their next slide says. So, and do. So there's interventions. One intervention, regular reassessments, see how it's growing, see what it's doing. Maybe it's not worth doing anything to it, but we don't really know till we can observe its behavior. Certainly, surgical removal of a superficial lump or bump is not that big a deal unless it's gotten huge or it's near a very sensitive location. We want to, when we remove a lump from tissue, we want to remove a wide margin around it of healthy tissue because what we see in terms of the tumor is not just the tumor because it sends out little tendrils into the tissue around the tumor. And so you need to get usually about an inch of healthy tissue around the tumor to be removed. And then you send that in for pathology, and the pathologist will tell you whether you got all the cancer or whether there still was some evidence that even though with as wide an excision as we made, there still may be cancer cells left in the body, in which case it's possible it could reoccur. Surgical removal of an internal mass is more complicated, obviously. Abdominal surgery or thoracic surgery involve a lot more of an intensive surgical amphitheater and sterile and all kinds of complications, which are more expensive and increase the risk, but may also be curative. You know what the surgeons say, to cut is to cure. So it could be that when you see a lump and you can get it out of there early on, you've cured it. That would be a nice outcome, wouldn't it? Um, with external lumps, we can also apply things topically. I know people have used THC or CBD topically on lumps, and that can help to reduce their growth. with the appropriate type of cancer. Not all cancers respond to CBD or THC. There's also some herbs that are caustic in their activity. There's an herb called neoplazine that's made from some herbs that has been used for many years in naturopathic types of practices. It can kill tumor cells, but it also can kill healthy cells. But it is one approach to consider using. With internal masses, we want to I recommend ultrasound. We start getting into cost here, but we also want to do the right thing. And we want to do the right thing with not excessive cost, but the right amount of cost. And ultrasound is a very accurate approach to learning what the involvement is of an internal mass. And with ultrasound, we can even put a needle through the body wall, guided by the ultrasound, into the mass and draw cells up, aspirate them without anesthesia, and put them on a slide to get a better idea of what it is. Or we can actually use a biopsy needle, which is another way of getting a biopsy relatively non-invasively. We had to cut the animal open, and get to that tumor and then take a biopsy of that tumor. And if you're already inside there, it might be smarter just to take the whole tumor at the same time. So having ultrasound and being able to do ultrasound guided aspirates or biopsies has been a great boon to early detection, determination of cancer, and making the right decision as far as what to do. So, we can remove it. We can address it with supplements. We could remove it and address it with supplements. As I mentioned, when a tumor is really big, chemotherapy, radiation, and supplements don't work as well as when it's much smaller. So sometimes going in and removing the bulk of the tumor, we call it debulking, actually allows these alternative therapies or conventional therapies to work better because there's less cancer. The more cancer there is in the body, the more it kind of builds up this momentum, and it builds up all of these other molecules that kind of fight the immune system and keep the immune system from doing the right thing in terms of destroying that cancer. So we want to keep the cancer as small as possible. And certainly pharmaceuticals. I recommend a combined approach. I don't think that that all the answers are found in conventional medicine with pharmaceuticals. I don't think all the answers are found in alternative medicine. And I think with cancer, you need to bring out everything you've got to treat that and to be aggressive with it. And be aggressive up front, especially if you find out it's an aggressive cancer. You want to be as aggressive as you can. Okay, so now the last slide here, and then we'll go for questions. And it seems like there's quite a few people that have been joined us, which is great. Um, what to do with interventions. And so last time I added this slide for today because we didn't really talk about the integrative approach, which is what I specialize in. And when I was in practice, when I was in clinic, this was what I did extensively, a lot of this work with a lot of different types of cancers with, you know, some success, reasonable success, not as much as I would have liked. And there's new tools available to us now that weren't available to me then. But I think that the most important thing when it comes to cancer is early detection. And we now have some testing that we can do on a regular basis before your animal gets cancer or before you even suspect it has cancer. I personally recommend once it reaches a certain age, maybe 5 years or 7 years of age, we know when a dog gets to be that age or a cat gets to be that age, that the risk of them developing cancer increases. So maybe don't need to do this when they're young, but this urine test, it's called Oncotech urine test. We do carry it on the website. I think we only have one more kit left, but we can certainly get more up there, and you can also buy it directly from the Oncotech website. Um, but you know how they talk about how dogs can smell cancer on people? Well, they can. And the reason why they can is because cancer produces these compounds called volatile organic compounds, VOCs. And that's what the dog's smelling. Well, this urine test, they don't have dogs sniff the urine. They've got nematodes, something called C. elegans, that apparently their sense of smell for this worm is 200 times greater than the sense of smell that a dog has. And we know dogs' sense of smell is huge. I've got a lab, the things he can smell me fixing dinner before I even think about fixing dinner, you know? So this urine, so the volatile organic compounds go into the urine, and you just collect the urine, You fill out the form and you send it off to the lab, something you can do at home. And they've validated it for 5 different types of cancers, but it also is generally good to be able to detect other cancers as well. So I think that's a good thing to do. And if you have the desire to 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 detect cancer early because it gives you the best outcomes, then you might want to consider doing this once a year or maybe twice a year as the dog gets older, twice a year. And if it's of a breed like a Bernese Mountain Dog or a Golden Retriever or a Labrador Retriever or a Boxer that are known to have higher rates of cancer, you might want to do it more frequently. And there's also blood tests, but that involves going through your veterinarian. And there's also imaging, which also means going through your veterinarian. I'm not trying to dissuade you from going through your veterinarian. I'm a very strong proponent of veterinary medicine, practitioner of it, and I think most veterinarians, are out to help you. They're not out to gouge you or just take your money. But it is expensive to fund a clinic with all this technology. So just understand that. Once you detect it, once you know it's there, we certainly have the conventional therapies that I've been mentioning, surgery, chemotherapy, radiation. They can be very helpful. I don't think you should rule them out completely. And there are some types of chemo that aren't as toxic as others. There's something we call the metronomic chemotherapy, which uses low doses every day instead of hugely toxic doses every 3 weeks. And we have found that that has been helpful, especially with certain types of cancers like soft tissue sarcoma. So you can combine your conventional therapies with alternative therapies. You don't have to use one or use the other. They really work together quite well. And just because your veterinarian or your oncologist is worried that the alternative therapies are going to diminish the effectiveness of their conventional therapies because they haven't seen the studies that show that's not true for most alternative therapies and for most conventional therapies, doesn't mean that you shouldn't consider that strongly. So, and there's a lot of things we can do, and a lot of things that you can do at home that just need learning how to do it, like diet change. I was surprised, when I did my cancer consults, at my practice, Well Pet at the Boulder's Natural Animal. Um, I used to put aside 90 minutes to talk with people about their cancer and try to learn more about what they wanted to do and to teach them the things that I thought they needed to do, which included diet. And I was always surprised that when I would ask people what were their goals in coming to see me, the first thing they would say is, well, I'd like to get her on a better diet. Diet is huge when it comes to cancer. It may not necessarily cure it, it may help prevent it, but it also increases the animal's resistance to the cancer and the animal's strength and the animal's quality of life. And we know that cancer cells feed on sugar, they feed on sweet things, they feed on carbohydrates. So a lot of the diet changes involve reducing the carbohydrates, maybe eliminating the carbohydrates, and feeding a higher fat and a higher protein diet. And it could be like a ketogenic diet, and using a type of oil called medium chain triglycerides helps with that quite a bit. So, so that's kind of what we would look as far as diet changes. Antioxidants can be very valuable to use with cancer patients. Um, and high doses of antioxidants, can be really quite good. I have lower on this list the use of intravenous vitamin C, and it's gaining more traction these days. That when you do maybe once a week or 3 times a week, you have to go IV with it. So it pretty much needs a vet to do that. But there are some technicians that will, in some places, that will come to your home and hook your animal up and give it that high dose of vitamin C. And the vitamin C, when you're giving it a high dose, actually becomes not an antioxidant, but a pro-oxidant, where the oxidation caused by the vitamin C affects and can kill the cancer cells. So antioxidants, and there's been a lot of spin that antioxidants can't be used concurrently with chemotherapy. A lot of oncologists are changing that tune as they're learning that antioxidants, especially antioxidants that are food bound, not necessarily the pharmaceutical antioxidants like vitamin E beta carotene, but more like the antioxidants that are part of food or part of herbs and plants don't seem to defeat the cancer therapies, but seem to help improve the patient's response and actually reduce the damage caused by chemotherapy, reduce the damage caused by radiation. Fish oil in a very high dose, specifically looking at the DHA. Fish oil has EPA and DHA. It's really the DHA that has the strongest effect, on the cancer, also having a pro-oxidant effect. Mushrooms, that's kind of my wheelhouse these days, and cannabis, herbal therapies, looking at turkey tail or reishi or cordyceps or maitake or shiitake or chaga. We sell a lot of these on the website, and I can give you some advice as far as what to use and how much to give to help the size of your pet and the severity of the problem. But we also have Chinese herbal therapies for cancer, and these have stood the test of time. And we have on the website the stasis breaker, the Wei Qi booster. These you have to go through me, or you have to submit a prescription from your vet for these. The company that manufactures them says that we have to do that. Same with bone stasis. The modified XFZYT is for hemangiosarcoma. You don't need a prescription for that. Yunnan Baiyao we use a lot with hemangiosarcomas, and it seems to not just reduce the bleeding, but also seems to reduce the growth rate, of that splenic cancer. Ozone therapy. Ozone's like super oxygen. Instead of being O2, it's O3. And cancer cells are very sensitive to oxygen. They live in a low oxygen environment. So by oxygenating the body better using ozone or using antioxidants or using, those types of oxidative therapies, we have a better way of killing the cancer cells. Mistletoe therapy, it's not just for kissing. Over Christmas. Mistletoe is a parasite that grows on trees. This is a European therapy, and it's becoming much more common in pets as well. It's a naturopathic therapy. It's given by injection. I have a friend of mine's dog in Denver has bone cancer in the jaw, and I've been helping them with the mistletoe therapy. But you have to be able to give those injections 3 times a week, and that's not for everybody. But it is something that could be done in home. And then of most recent interest to people are these two wormers, these two veterinary wormers, fenbendazole, which is a veterinary wormer I've used for years treating worms, and ivermectin, which is the drug that we use to prevent heartworm and to treat certain parasitic infections, and was thought to be helpful with COVID, but that has been debunked. But it turns out that it actually can be pretty effective with cancers. Before we came on, I was doing a bunch of library research on the internet, and there's a lot of papers, a lot of published papers, peer-reviewed papers in humans about the use of these two wormers, and even offered some dosages for humans. I'm working on developing some dosages for animals so I could be comfortable in terms of when I recommend that to you. So that's kind of it. It's a hodgepodge of a lot of different things. Um, and when cancer strikes, it gets our attention, and we really need to step up to the plate and take a healthy swing to knock that ball out of the park, using the baseball analogy here, and and provide our pets with a longer life and better quality. So that's the teachy part here. We're done. I'm gonna turn this off, stop my share, and then we're open for questions. And well, we got 37 people today. This is great. I like having a lot of people. Good. Can touch more lives, help more pets. So what's up? Bring it on.
So I'm going to start out with a couple of questions from the chat here. Can you repeat the oil you mentioned to add to the keto diet when you talked
Yes.
about diet changes?
Well, medium chain triglycerides are found extensively in coconut oil. And these are not the long chain fatty acids like we see in fish oil. And these are kind of medium chain sizes. And they have the advantage in that they go directly into the mitochondrion. They don't need carnitine to carry them in. And so a lot of athletes use them to get instant energy. Though, when you see athletes running marathons and they're kind of, sucking on this goo or something, a lot of it is medium chain triglycerides. And what we know about medium chain triglycerides is they kind of convert the body from a metabolism that metabolizes sugars to a metabolism that metabolizes fats. And what we know is that cancer cells feed on sugars. When they do those PET scans for humans, when they have cancer, they inject you with a compound that has a sugar-like compound in it, and the sugar goes directly to the cancer cells. Then the sugar is linked to some sort of a dye. So when they do the imaging, they can see where the cancer cells are because that's where the sugar went. So that's one of the strategies for a human who has cancer or for a pet who has cancer is to reduce the sugar calories, simple sugars especially, but also complex carbohydrates. So foods like kibble, which are high in carbohydrates, are not really that appropriate for the cancer patient. Medium chain triglycerides help to shift the body to a fat metabolism from a sugar metabolism. So you feed the medium chain triglycerides, you feed a moderately high protein level, and you maybe add additional fish oil and flaxseed oil to the medium chain triglycerides to provide a lot of calories from fats. And that's the ketogenic diet, or that's what they're talking about when they call it the ketogenic diet. Next question.
All right, next question here. So I think this was in regards to you discussing the biopsy.
Mm,
Do tiny dogs, for example, less than 5 pounds, do they still need a 1 inch margin?
yes, they do. Because the cancer can grow through the tissue and it can grow extensively. So, I mean, sometimes even an inch margin is enough if the tumor has really grown. So, no, the tumor doesn't adjust itself based on the size of the animal. But that's a good question.
All right, next one here. Are there any natural supplements that can get rid of, is it lipomas?
Lipomas.
Lipomas, sorry.
Um, there's a lot of talk these days, and if you're on TikTok, you're probably seeing all these ads for turkey tail. So there's a lot of talk that turkey tail may do that. And turkey tail is known as a mushroom to have been used historically for hundreds of years by indigenous people to treat cancer, as well as other mushrooms to treat cancer as well. So, a good friend of mine who's a canine herbalist, her name is Rita Hogan, has a book called Canine Herbology. She's great. And one of these days we may have her here as a guest. I'm thinking about starting to bring some guests on to have some conversations with. But she has said that she has seen turkey tail affect lipomas. I don't believe things till I see them or I see them written down in some kind of an objective report. As much as I love her and I trust that she's really doing that she really did observe that. My dog Ollie, who I've mentioned a few times, he's got a lot of stuff going on with him. He's older, he's a lab, and he's developed a number of lipomas, on his body. And so I'm starting to treat him with a high dose of turkey tail to see what's going on. But let's see. I've got a lipoma too. I've got one right here. And see that little thing? Looks like a little bubble underneath my skin. I've got one on my back too. And I've been taking a lot of turkey tail personally for the last year at least. And my lumps haven't gone away. So I don't know. But those lipomas are so annoying, aren't they? They're just like always in your face and they're not cosmetic and you want to remove them. But right now, the only way that we can remove them is surgically. And who wants to do surgery for a cosmetic reason? Well, I mean, some people do, but it depends on the animal's health. If you're in there for a dental, yeah, it's doing that thing with me again. I don't, the Zoom's got some weird new bells and whistles, but so, but if you're doing something, if you're going under anesthesia for another reason, let's say you're going in for your annual or your dental cleaning. So while the animal's under for the dental cleaning, that would be a good time instead of having to do multiple anesthetic events to also remove that lipoma. And oftentimes that's what I would do. And maybe your vet would do that as well. But they are very annoying, but they're not a danger. They're just annoying to look at.
Next question. Would you recommend stasis breaker for lipomas? Warts?
I have not seen that stasis breaker works for lipomas. I have heard a little bit of rumors that maybe it does. Stasis breaker is a Chinese herbal formula. We think of in Chinese medicine or Chinese medical philosophy, we think of tumors as stagnation. If the energy's not moving, it gets all stagnant, and that's why it forms that lump. And you can have different kinds of stagnation. You can have blood stagnation, which is pretty much how we describe hemangiosarcomas. You can have phlegm stagnation, which is how we describe lipomas. So the stasis breaker is supposed to break up that stasis. And theoretically, it could work on the lipomas, but because lipomas are benign, I think the stasis breaker works better on cells that are actively dividing. And I don't think you don't really see that with lipomas. It's worth a try. It certainly wouldn't hurt. And I have had people ask me to have the stasis breaker because their dog did have lipomas, and I've let them know that I don't know if it's going to work, but you're welcome to try it. Um, so it's something that that maybe if enough of us try it and see some success, my guess is it might work in some animals and not in others. We also can see with some lipomas that they have a kind of an episodic course of how they behave, in that sometimes they can actually get smaller spontaneously, or we don't really understand why, or they may be responsive to the fat content in the food or other reasons. Dogs that have thyroid conditions where they don't handle fat very well oftentimes can have more lipomas. So, but fortunately, regardless of whether we can treat them with stasis breaker or turkey tail or both combined, I mean, herbs and mushrooms together is really the gold standard. It's really the way to go. Um, at least, fortunately, they're not really life-threatening or dangerous, just annoying.
All right, next question here. Do you have any recommendations for skin tags? I think my dog has a skin tag on her lower stomach and want to know if there's a way to get rid of it at home.
Yeah, we don't want to go to the vet, do we? The skin tags are oftentimes just what we call epitheliomas, which means they're little benign tumors of the cells that grow on the epithelium. And they can be very easily removed surgically, with a little bleb of lidocaine, and maybe, in an animal that is amenable to being held, can be very easily removed. Sometimes they can even be cauterized or burned, without needing to have stitches or things like that. At home, I don't really have anything that I can suggest. I don't think that there's an oral treatment like a herb or a mushroom or some other thing, so that I don't think there is a way to treat them yourself at home. And generally, they're just annoying. Sometimes they will be in an area of the animal where they can get damaged and cause some bleeding, that sort of thing. You could just I mean, you could snip it off with the scissors, and maybe it wouldn't grow back, maybe it wouldn't hurt your dog, but I can't recommend that. They're like lipomas, they're annoying, and unless they're in an area that's really causing problems, I would just try to ignore them.
All right, next question here. I have a 16-year-old female Devon Rex kitty who has a lump under the skin along her spine in the exact location that she received injections back before I knew better about what injections were needed. She has had the lump for several years and has stayed the same size until recently. It is now slightly larger, but still moves back and forth under the skin layer, so not in the muscle and does not bother her. I was thinking about trying a dump a lump essential oil blend to decrease the size. I am just worried that if it continues to increase in size, it may cause an issue. She also has many lumps growths inside her ears. Her vet said that that sometimes happens in older kitties and there isn't anything that can treat them. I do think they are affecting her hearing, but she is able to have a good quality of life. I'm just wondering if there's anything that can treat these ear growths.
Well, I'm assuming that you're talking about two things. You're talking about some growths in the ear and a growth under the skin, maybe up by the shoulder blades where off where we used to vaccinate our cats. And the big issue is that we have found, especially in the cat, and especially with rabies vaccinations, that in some situations they will develop a very nasty, aggressive, difficult to treat tumor, a soft tissue sarcoma that's vaccine associated. And they're very nasty and very aggressive, and surgery doesn't really do a complete job because they do just reach out throughout the tissue. Oftentimes they'll combine that with radiation. It's nasty. So for that reason, we have changed where we vaccinate cats because cats are so, and we can see that we have seen this in dogs, but not nearly as frequently as in cats. So we now vaccinate cats in areas of their body like the tail or the hind leg, that if a nasty tumor like this were to arise, the best treatment would be amputation of the tail, amputation of the leg. I know that sounds terribly, terribly aggressive, but it's so much better than dealing with the invasion of this aggressive tumor into the tissue, which can create a lot of pain and discomfort, destroy quality of life, and eventually take their lives as well. So I don't know, for what you're describing, the loosely attached thing, I'm suspecting it's not that. It, of course, would be good for you to have your veterinarian aspirate it and find out what it is, or maybe when the cat's in for dental or something, have it removed. The things in the ear, I'm a little curious about those, whether they might be warts, or whether they're down in the ear canal, in which case it's a polyp. Those are the most commonly found lumps in the ear of a cat. And again, it depends on the nature of those lumps. And, if it's a polyp in the ear, they do interfere with hearing. And what we used to do was go in with a forceps and just forcibly remove that from the ear. And that oftentimes helps them to hear better, but it will oftentimes also grow back. And so the treatment of choice these days, if it really is a polyp in the ear, is with a more invasive surgery where we go behind the ear and kind of cut into the ear tissue in order to surgically remove that as well. So, I mean, when we talk about cancer, we're talking about, some aggressive treatments for it, because if left untreated, you have to weigh the risks to the benefits. Nobody wants to put their beloved animal under surgery or spend the money to do that. But you just have to, for yourself, everyone decides for themselves how they want the animal to be, and it's governed in part by their budget, but governed in part by their philosophy of life, those sorts of things. um, but when it comes to cancer, I think it's much better to be as aggressive as you can up front. As soon as you detect it, I think you're going to get the best outcomes with that.
All right, next question. My pup has a hematoma about 1 inch on the inside of the ear flap from scratching. He has allergies, and I just started his meds again, Apoquil, and I have been applying a heat compress for the last 24 hours in hopes it will drain and go away. Do I need to have this done surgically, or can I use the heat to try to help drain?
So what you're describing is what we call an oral, not oral, but oral, AURAO, hematoma. And oftentimes it happens because they shake their head and the ear flap hits something and breaks a blood vessel and then develops a little hematoma in there. And it can be, it's generally not painful or uncomfortable to the animal, but the only way to resolve that so that you have a normal ear flap again, is to drain it. And I've tried a lot of different approaches with oral hematomas. They're really pretty common. I've just tried putting a needle into it and drawing the blood out. I've tried doing that and then kind of tying the ears up on top of the head to put pressure on them so he doesn't doesn't shake them and re-injure that. The best solutions, the I've tried putting like a what they call a teat cannula. It's used in dairy, where you kind of insert that into the hematoma and you let it kind of drip the blood out while the ear is healing back together. It's kind of messy, but it can work. And you can also use that same kind of bandaging technique so they're not shaking their head and your household doesn't get that messy. Um, The best solution to it is a more invasive surgery where we actually kind of cut a little thin strip up the middle of that hematoma so we get a lot of drainage, and then we use a mattress type of stitch that stitches both parts of the ear flap to the cartilage that underlies it, and then it heals back pretty normally. Now, you don't have to do that. You can apply heat, and you can and sometimes and there's a Chinese herb called Yunnan Baiyao. I mentioned that with the treatment of hemangiosarcoma. Yunnan Baiyao helps bleeding to resolve itself. Um, you could also use that Chinese herb. But what will happen if you just apply heat to it and we don't drain the blood out is as the blood clots, it'll start adhering to the cartilage underneath the skin, and it will cause a contraction of the cartilage. And that's where you get what's called a cauliflower ear. It doesn't look very cosmetic as far as that ear, but it's not painful. It's just ugly. But that's where fighters get punched in the ear and they get hematomas as well. That's why we talk about cauliflower ears in fighters too. It's the same thing. So it depends, how old your animal is and what you want. The allergies probably were the cause for this, because it was either shaking its head or scratching at its ear or something like that. The other cause for it could be a fight with another dog, or if you have a cat in the household and the cat goes, yeah, and its sharp nails, cause a blood vessel to rupture inside that ear flap.
All right,
These are
next
great
question.
questions, by the way.
Why is modified XFZYT for hemangiosarcoma? My dog is on stasis breaker and Wei Qi booster. He had a hemangiosarcoma tumor removed 1.5 years ago.
Well, you're doing very well if your dog is still alive a year and a half, because the average lifespan, even with splenectomy, is maybe 3 months, 4 months. Um, Stasis breaker, I think, could obviously is working for you with your animal. The definition and I personally recommend both for hemangiosarcoma. But in terms of traditional Chinese medicine, um, the modified Shuivu Zhuyutang, which is much more difficult to say than XYFCZ, is meant to resolve blood stasis. And that's what I mentioned before about stasis breaker and stasis. That is blood stasis. That splenic hemangiosarcoma is what we call blood stasis. So it has two herbs added to it. That's why we call it modified. Typically, the Shuivu Jiutang is used for congestive heart failure and for problems in the chest. But when we add these two herbs to it, they help to move the blood better and can work anywhere in the body, even in the middle part of the body as well. So it's traditionally what would be used for the splenic, but the stasis breaker could also be used. And there's a third Chinese herbal formula that I'm looking to add to my inventory that recently has been the subject of a study, and it looks very promising, and I'm still kind of figuring that one out as well. So you're not doing wrong by using the states. Obviously, your animal has survived a year and a half and hopefully much longer. So whatever you're doing, keep doing it. It's a nasty disease, and if you can get that much life from that, you're very, very lucky.
All right, next question. What do you recommend for sebaceous cysts?
Yeah, sebaceous cysts are a pain in the butt, aren't they? And the dogs that have them, have them a lot. Oftentimes we see them in those little poodles and things like that. So yeah, I don't. I think that ultimately they come from a failure of metabolism interacting with the diet, and so I do. And so once they've gotten started in the body, they're a lot harder to stop. This is one reason why I advocate for healthy, um, as unprocessed diets as possible, starting as early in the animal's life as you can, because I think it changes the metabolism of the body, so there's less likelihood for that. And certainly feeding things like flaxseed oil or flaxseed meal, fish oil, medium chain triglycerides, healthy fats can help with these sebaceous cysts. But cysts can oftentimes be much more difficult than cancer because they arise over the body. You surgically remove one, and one arises over there as well. So I don't have a really good solution that's a really good, easy solution for those. I think they need to be addressed basically based on the individuality, and what things are going on in the environment and lifestyle as well. And they may be kind of a form of an allergy, that the skin is reacting in a way. There's mushrooms that we could use that could help improve the health of the skin and the health of the immune system. So I mean, if I were working as your vet and you had a dog that did that way, I certainly have a lot of things that I would apply. Whether they would be successful or preventative is really remains to be seen.
All right. So I read on a local vet's website, but can't find it again, that high doses of EPA can inhibit the action of natural killer cells. Your thoughts?
EPA, you mean the fish oil?
Think so.
Well, I tend to disagree with that. Um, but I don't know what that vet was referring to. There may be a study where it shows that, but generally, we think of fish oil and we think of high doses of fish oil as having an anti-inflammatory effect. Well, anti-inflammatory also means that it reduces some of the activity of the immune system. Generally, I don't associate with reduced activity of natural killer T cells, more with the pro-inflammatory cells. And that's why we recommend fish oil so much at higher dosages because you need to because it's how you reduce inflammation. So I also don't know from this website that you read that you can't find again what a high dose means as well. Because it may be that, yeah, a super, super high dose of anything is going to cause different effects than a physiological dose or the appropriate dose. With fish oil, the way that I recommend dosing it, based on a published article in the Journal of the American Veterinary Medical Association, um, is that you take the amount of EPA in your product of fish oil and you add that to the amount of DHA in your product of fish oil. And then that sum of those two together, you dose that at 100 milligrams of that sum per kilogram of body weight per day. So and that's a pretty high dosage. That comes out to maybe, with a standard fish oil capsule, it's maybe one capsule for every 10 pounds of body weight per day. So big dog, that's a lot of oil. Um, so that's my answer to that. I think probably he may have been quoted. I mean, and vets are great, but oftentimes they're not scientifically oriented and they just kind of read, the abstract on a study and don't really dig down. When I read studies, one of the first places I go is called the material and methods. And in that, they tell you what dosage they use and what product they were using in that experiment. And so it may be that the dosage on that particular study was super, super high. Because get super high doses of fish oil, you can have problems with bleeding. It reduces your clotting factors and things like that. So I'm not sure exactly, but that's my story.
All right, another question. My 9-year-old spayed GSD has a lump beneath one nipple. The lump is fairly soft, approximately 3/4 inches across, does not appear to bother her in any way, and isn't visible. You need to touch it to know of its existence. I discovered it approximately 2 weeks ago. She'd been spayed before I adopted her at age 7, but I have no idea, or she was adopted age 7, but she had no idea what age she was spayed. I doubt she ever had a litter. She is on a home cooked diet, 1/2 teaspoon turkey tail powder, 1/2 teaspoon lion's mane powder in adherence with the manufacturer's instructions for 76 pounds, and occasional CBD. She does suffer from allergies and leaky gut, which are being treated with herbs, homeopathic remedies, and allopathically. Other than monitor the lump and worry, what should I do?
Well, I wouldn't worry. I would have it aspirated. That's what I'm referring to, early detection. It's in an area where we oftentimes can see cancer arising, the mammary tissue. You don't know when she was spayed. We know that, and what this person's referring to, in case everyone else isn't aware of that, is with each subsequent heat, that a dog has. And with litters, it increases their risk of breast cancer. So that's one reason why we recommend spaying as early as possible and to not have a litter unless you're a breeder. And, so it's possible that this dog may have, this may be a form of breast cancer, maybe a very benign form or a very slow moving form. And to have an aspirate done is so simple and so non-invasive. And, whether your vet can read it or he can take the slide and send it off to a pathologist, that would be the way to put your mind at ease, or to do something to get it taken care of. You're obviously very proactive with all the things that you're doing for your animal, going both, complementary, alternative, and conventional. So I think, that's what I would suggest. Get an aspirate, or do the urine test.
For small dogs that don't want to eat mushroom powder in their raw or gently cooked food, is it safe to try mushroom tinctures or is the alcohol content in tinctures risky?
Well, okay. When it comes to tinctures, um, if you're using an alcohol extract of a mushroom, then you're not getting the beta glucans, which have to do with the immune process. You're instead getting the fat soluble components, which oftentimes are the terpenes in it, which do have some effectiveness, but aren't the same as taking the whole powder. If you take a tincture that is a more of a glycerin based, it's going to have some of the beta glucans in it, but it's not going to be as potent as the powder itself. So I think the tinctures are okay for small animals, but it depends what you're using them for. And you're either going to have to give a lot of that liquid or just be giving a small amount for wellness. So mushroom powders are not all the same. Some of them, yeah, are pretty nasty tasting. I have trouble with them myself. Some of them are not that nasty tasting. And it might be that choosing a different species of mushroom, maybe a different company's product, that has mushrooms in it, because there is some question about mushroom companies or companies that say they sell mushrooms that in fact um, aren't really mushrooms in there, and that's a whole nother story. But I would say maybe try a different type or reach out to me through my email and let me make a suggestion because lion's mane is a very tasty mushroom. Some people say it tastes like lobster, and the powdered lion's mane is very bland, as is the cordyceps mushroom powder as well. I like the cordyceps a lot. I think it's kind of sweet tasting, actually. So, and they have beta glucans and anti-cancer properties and a lot of good properties as well that mushrooms have, that maybe you don't need to use a powder that is not so tasty to your little dog. I think the powders are really the best way to go if you really want to get the full potency, of the mushroom compound.
Next question. So, weight chi booster for dogs. Is one capsule the same as one tea pill?
No, not at all. The capsules contain 500 milligrams, and the tea pills, if you're talking about the tea pills, they're much smaller, much, much smaller. So we use the tea pills for small animals, small dogs and small cats. Um, but you might still have to get quite a few in there. If you're using something like Weight Chi Booster or Stasis Breaker, and you're trying to use herbs to treat cancer, ultimately you want to start low, but you want to work that dosage up as high as your animal will tolerate and as high as your budget will accept if you're treating cancer. Um, Wei Qi Booster, some people are using it just to improve immune system response to it. And in some cases, we can see the Wei Qi Booster also helping with appetite. So it does have other uses than cancer. So if you are trying to treat cancer, I would go with as high a dose as you can get into the animal. Some small animals aren't going to be that happy about taking a 500 milligram capsule. So the little tea pills, they can hide better in food. They're kind of sugar coated, and they also have smaller capsules depending on which of the formulas you're using. Like the bone stasis has 200 milligram capsules, which are much smaller than the 500 milligram capsules. So It depends what you're treating, and depends on your animal's compliance with administration, what you would be using. The T pills are substantially cheaper, and so that makes them attractive, but you have to realize that ultimately it's the amount that you're getting in there to do the job. And so they are for smaller animals, though.
All right, next question. Is the Oncotect urine test available in Canada?
This is a question I don't know. I'm sorry, but I would go to the website and ask them yourself. Whether they ship cross-border or not. It's really a pain in the butt, isn't it? This whole cross-border stuff between our neighbors to the north and south, and not don't we even want to get into the whole tariff thing. But I would reach out to them directly through their website. They're very responsive. They're a good company. I know the guy that founded it. He's a cool guy. So yeah, talk to them. I hope they do.
With a tumor that is bleeding, should you avoid stasis breaker and or chaga?
Tumor that's bleeding. Um, No, not necessarily. The stasis breaker is not going to increase the bleeding. Um, Chaga, I'm not really familiar with chaga having an issue with bleeding, but you know, um, maybe it does, but I know quite a bit about chaga and I haven't really seen that as a problem. You might be interested in trying an herb like Yunnan Bayao, which is made from pseudo ginseng. We sell that on the website. We sell it in two different versions. We sell one that comes in a box that has English language, which is more expensive because they had to print the boxes in English language. And we have one that comes in Chinese language. They're identical products. And I ordered the Chinese language box directly from China in order to get a good price. I had to order 400 of those at a time. So it's much less expensive. And I thought there's some people that use a lot of Yunnan for their dogs, especially with hemangiosarcoma. It's an ongoing thing. We don't just use it to stop the bleeding. We also know it slows down the growth. And the Yunnan Bayao could be good for this bleeding tumor, whatever it means by bleeding tumor, not quite sure. Um, so you might want to look at that as well. And I'm surprised because people are so kind of China phobic that even though it's a substantially cheaper product, and I've written multiple times that it's identical, people still prefer the more expensive product because it's got the English language on the box.
All right, next question. Can you comment on the efficacy of the Oncept melanoma vaccine for use in cats? Can't find much info on this. My 9-year-old cat has had 2 surgeries and SRT. Started vaccine after radiation treatment, and so far no cancer detected. I also give turkey tail and 5 defenders.
I can't answer that. I really don't know. I would ask your oncologist about that. Um, I didn't even know it was approved for use in cats. I'm sorry about that. I just don't have that knowledge.
What daily mushroom supplement do you recommend? No diagnosed issues so far for our 10-year-old dog. I'm giving 5 defenders currently. Is this the best supplement for us?
Five Defenders is good. It's the most popular product made by real mushrooms. I've made a product that incorporates the Five Defenders and has a few other things in it. The Daily Dog, uh, which has become so popular, we're currently back ordered on it. We're switching to manufacturers, and that's an issue. But the Daily Dog has the Five Defenders in it, but also has two more mushrooms in it. It has lion's mane and cordyceps. It has active live probiotic cultures in it. It has detoxicants like cracked cell chlorella, has ashwagandha and astragalus in it, and uses krill meal and nutritional yeast as its kind of base, its powder base. Um, but right now, it is back ordered. I don't think you're going to be able to get any. We had a meeting today, and I'm pretty upset by it. But what can you do? Supply chains can sometimes be a bear. So I think for now, I think the Five Defenders, no problems, not treating anything specific, just wanting to get some wellness in there on a daily basis. I think that's the way to go.
All right, next question. At the Feed Real Summit, Chelsea K mentioned in her presentation lipomas can be a result of lack of hormone in dogs who are spayed or neutered at a young age. Thoughts?
I don't know. We see them in spayed animals and non-neutered animals as well. But certainly, there are issues the um, with gonadectomies, with spaying and neutering early. We know there are issues as far as the incomplete um, the absence of those hormones to provide support for growth and development in their early years. And it's a trade-off. I mean, who's been to the Humane Society? Who's been to a shelter lately to see all the unwanted animals out there, all the animals that are out there breeding indiscriminately? So that's one reason why we have created this, strong imperative to spay your animal early. I think that looking at that and waiting a little bit until they reach sexual maturity and then spaying them or castrating them is more likely to allow those hormones to benefit the growth and development of the body. Um, and whether lipomas are a result of that or not, I'm not sure. I'd like to see, some sort of a controlled study in which we could enumerate, lipomas on animals and whether they are neutered or not, and how early were they neutered. Um, I'm not saying I don't agree with her. I just don't really know. And I was at Feed Reel as well, so I know what you're talking about.
All right, next question. I have a Chihuahua who has a lipoma on the front of his throat. It's pliable and is not currently causing any issues, but I'm worried if it grows any further, it could start pushing on his trachea. He does tend to cough and hack whenever he play growls with his toys, so I'm wondering if that's because of the lipoma. Would you recommend removing that lipoma during his upcoming dental, or is it dangerous to remove a lipoma in that area? Have you ever heard of lipoma coming back more aggressively after surgical removal? I'm just trying to weigh the risks of leaving it alone versus having it surgically removed.
Generally, lipomas, if they're well removed, don't return because they are benign, except for the lipomas that are malignant, which are called liposarcomas. And as I mentioned earlier, they're a bear to remove because they, like other cancers, they send their little tendrils out into the tissue. So even when you get the bulk of the tumor out, there's still remnants in the tissue. Um, is it risky to remove it there? No, I don't think so. And in fact, while your dog's under anesthesia, it's not a bad idea. Have you asked your veterinarian about this? I think they're probably in the best position to give you a good answer because they've got their hands on your dog, and they can see what the size of it is. It's likely being a soft mass that it's not going to impinge on the trachea. But we also see in smaller dogs a condition called collapsing trachea, in where it's not the front of the trachea, but it's actually the back of the trachea that has a membrane that is a little bit loose, which can cause irritation. So when they bark, or when they're breathing heavily, they can actually cause that membrane to go down into the inside of the trachea and cause some irritation, which then causes coughing. So it might be that you've got something else going on there as well. But it's not a bad idea, as I mentioned earlier. And and generally the surgery is not going to stimulate regrowth, of a benign lipoma, if that's what it is.
All right, next question. I use a number of your products you formulated, such as RX Renal Canine, which I give 2 tablets a day. I take it apart and add it to the food. Plus, I give Daily Dog RX Biotic and RX Liver Supplement. My dog is 15 pounds. And I find with the supplements, there's so much powder I'm adding to his food at times, he will not eat it. Are there any other suggestions how to give him the supplements that are helping him so he will eat them?
Well, um, what I do for Ollie is I have like a little bowl. And I because he hates capsules, he will not take a capsule. And and some of the powders obviously I put into his food, but some of the other powders I'll put in a little bowl and I use some bone broth. He likes beef, so I use beef bone broth. I mix that in, and then I got a can of dog food. And I don't generally recommend feeding canned food or dry food as a regular diet because they're ultra processed. But a little bit, doesn't hurt, and he'll kill for canned food. And so I'll mix the powder in with the bone meal, and then I'll put maybe a tablespoon of the canned food. I usually buy canned foods that have a lot of gravy in them because that means they're mostly liquid and they have fewer calories. So you're not really contributing more calories to their overall caloric intake, especially if they're a little bit on the chubby side. And then he looks forward to that. I put that down for him every day. Now he kind of expects it. He sits in the same location, looks up at me like he's either saying, "Take me for a walk," or give me my bone broth. So that's one solution. I think, making it into more of a liquid and making it more palatable and feeding it separate from the food. Because yeah, it definitely could be a problem if you're doing if you're helping them as aggressively as you are with all these supplements, that the supplements can really get in the way of the food too when you add it to it. So you need to have some other strategies like this, and you could spread it out during the day at different times than when they're eating. Maybe use it as a reward or some kind of a way to manipulate their day, to keep their day more interesting, to enrich their environment, to keep them excited and interested in being alive.
What do you recommend for dermatitis on the lip folds around the mouth?
Okay. Well, a lot of it depends again on the metabolism of the animal. We do see in many animals that have these lip folds around the mouth, whether they're Frenchies or Bostons or Shar-Peis or whatever breed. We know there's a number of breeds that have those skin folds, and because these skin folds are, they retain moisture, they're good breeding grounds for bacteria, for yeast to grow and be irritating. So probably the simplest thing to do is to get some wipes, maybe some wipes that are mildly antiseptic, but mainly just wipes to kind of go into that skin fold. See, I've got them too. Go into that skin fold and clean it out, and then dry it, with something else to dry it out. Um, in terms of just the simplest thing to do with the skin folds. Now, there's things that we can do as far as diet. There's things that we can do in terms of supplements, like mushrooms. Particularly, there's a mushroom called tremella that we could combine with another mushroom. I mean, there's all sorts of ways of treating it with supplements that could be helpful. I don't know enough about your animal, what it eats, and what other problems it might have. But I think, topically, it's simple, it's non-invasive, it's probably the least expensive way you can do it. And it's a way for you to connect with the animal as well and make it into a game, make it fun, give a treat, when you're done, that sort of a thing to encourage them to allow you to do it, ongoing. They may even look forward to your cleaning out their skin folds.
All right, so this is the last question that I do currently have here, and this is one from email. My apologies for missing this one my first time around. I purchased Dump-A-Lump for a few spots on my golden Oscar. I
Oh,
used
uh-huh.
Dump-A-Lump. Yes,
I, who comes up with a name like Dumpalump? Oh, go ahead. I'm sorry.
I used a little too much and did not use a carrier oil, and it irritated him. I realized I needed to use a carrier oil. I reached out to them and asked for the correct ratio of carrier oil to the dump-a-lump, and they emailed me back asking for a photo of the spot we wanted to treat. After that, they never replied. I sent several follow-up emails and texted the suggested number as well as joined their Facebook. It has been several months and several attempted correspondences. Do you have any idea how to get a hold of them, or do you have any recommendations on the ratio of carrier oil to the dump-a-lump?
Well, I think from my reaction to that name, I think you know that I've never heard of this before. Um, and I'm sorry, what is she applying it to?
Um,
A
just
lump?
for a few spots. Yeah, a few spots, she says.
Irritation, inflammation? Not quite sure. Um, yeah, I don't know. I don't know what's in it. I can't really answer your question, I've never heard of it before. I would probably go with a um, you know, is are you is that there was just a comment that that's something by that's a
Yes. Dr.
oil.
Melissa Shelton. The company is Animal
Yeah,
EQ or EO,
I
sorry.
know as well. So it's an essential oil
It's
then.
an essential oil blend, it seems like.
Oh, and that's why you're looking at a carrier oil. Right. So, I guess I would probably use maybe, 5 drops of the Dump-A-Lump, um, to, maybe, um, 5 cc's or a teaspoon of your carrier oil, which probably would be something, like medium chain triglycerides or olive oil or safflower oil or whatever you might be choosing for that. You could even use fish oil topically, which might be good.
And actually, I just looked it up and I am seeing a little bit of information here. I'll just share it with you,
Oh, sure.
Lauren.
Yeah. Mhm.
On the product page here under let's see, under additional advice. So yeah, that was the last question we did have.
Okay. What about this next one?
Oh, did I miss something?
Oh no, that was before that about the ozone machine. Did you see that in the chats?
Oh, no, 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 nope.
Okay, well, let me
Um,
do. I've been considering buying an at-home ozone machine, but I'm a little nervous about it. Do you think ozone is safe to administer at home instead of only at the vet's office? My dogs have had it at the vet's office before with no issue. So, ozone is kind of super oxygen, and it can have a great deal of value. I'm looking to get an ozone machine actually to use myself here at home, and we're using it for a variety of things. We can use it rectally, and oftentimes it's being used prior to microbiome restorative therapy. It can bubble through fluids and be used by an injection. I would think that an at-home ozone machine, you would probably be maybe bagging a limb or maybe doing rectal. It can be toxic, it can be caustic, and you need to, it's not something trivial. It's not 100% safe, but it can be used safely. So I'm not against that. I think there's a lot of in-home therapy. Um, um, yeah, that there's a lot of that. I like that I'm seeing a lot of pet parents looking to do in-home therapies. Things like lasers. In fact, I've got, I have a relationship with a company that I got my own laser from that I'm thinking about offering laser rentals through our website as a way of, because lasers can work really well for musculoskeletal problems, but you have to keep going back to the vet. They're best if you can do it like every day or every other day yourself on the affected limbs. So I think there is a lot of value to this, to really, taking charge of your animal's health yourself as much as you can if it's safe. And I think ozone machines could be used safely at home, but make sure you get good instruction on it, first. And make sure the company can, talk to the company some more and see what they offer you as far as training on it and safety precautions and things like that. And you know, you, so that would be what I would say. But ozone can be a great tool to use. Absolutely.
and then another question here. Did I understand correctly that lipomas can become malignant? If so, how does that happen?
Well, generally, lipomas don't become malignant. Generally, you get malignant versions of lipomas arising spontaneously in the same way that a lipoma arises, only it arises malignantly. So it's not generally that the benign turns into malignant. It's just the malignant arises of its own. So, and in my career, my vast experience, of my career, I've not seen a lot of these liposarcomas. The ones I've seen are nasty, especially like they're in the armpit, and you've got you've got the brachial plexus with all the nerves and arteries and the lipomas in there, just adhering to all of those delicate structures. They're really hard to remove. So So we're getting more questions.
We
There's
are, we are. So we have what do you recommend for warts?
Well, I've had a lot of success treating warts with antiviral herbs. And so I would look at antiviral herbs and I would look at mushrooms as well, because warts typically are a viral infection, the papilloma virus. And if we can get that viral infection under control, we can cause the wart to go away. Now, another approach to treating warts is something that we used to do in the old days, where you would take a hemostat, otherwise known as a roach clip, take a hemostat and you would crush that wart. I mean, and it generally wasn't painful to the dog, but it might be a little. You crush the wart, so you create a blister where the wart was. And in that blister, it's like this fluid, this tissue fluid, but there's antibodies to the virus for the wart in that tissue fluid. So it's like a vaccination, it's like a wart vaccine. And so that was what we used to use. And typically, I would probably use both. It depends on the wart, depends where it's located, and depends how many you have. Most warts are the papilloma virus, but there's another type of wart that comes from a virus called the transmissible venereal wart, and they generally occur around the genitals and are transmitted through sexual activity. And I'm not sure I would be crushing those if they're down by the genitals. But using an antiviral herbal approach, andrographis as a single herb, it's a Chinese herb, is very antiviral. So seeing formulas that have that in it, violet leaf is very antiviral. There's a number of great antiviral herbs out there, and combining them with a mushroom would be the best bet for a wart.
All right, next question. What are your thoughts on phytoplankton? I heard others say that calamari is better.
I'm not sure I understand the question. I hadn't really thought about calamari, using calamari medicinally. I love it. Um, but phytoplankton can be quite good. Now, some phytoplankton, phytoplankton is a kind of a single-celled organism, and it has chlorophyll in it, so it can be a very good nutritional product to take on. As far as that, I don't know that I would specifically recommend it to treat this disease or that, but I don't really see how phytoplankton relates to calamari.
And then what home laser do you recommend?
Well, I don't really have a brand to mention. The one that I use is called multi-radiance, and that's what I would offer on the website if I could ever find time to get my affiliates together. Because I'm planning on offering more diets and other things that we won't carry ourselves, but which I have vetted the companies and the products that you can then order them through us, and you get a bit of a discount, we get a bit of a kickback, and everybody's happy. But I think laser technology is pretty well established, and I think that there's probably a number of lasers out there that are good for in-home use. The question is, what is the strength of it? What is the class? The lower classes, the lower strengths, oftentimes don't penetrate deeply enough and may not or may need much longer exposure times. Whereas the more powerful ones can be dangerous. You have to wear those glasses. If you point them towards your eye, it can cause some damage. And the really strong ones, if you put them too long on the skin, can cause burning. So the multi-radiance is a low potency, but it has a special frequency that it uses that enhances its potency without having the danger of damaging the eyes or damaging the skin. And so that's why I got it for myself and for use on Ollie. I've got arthritis in my hands, so it helps there. Um, and so that would be the sort of laser that we would recommend. Also thinking about adding on some pulsed electromagnetic force devices. And I don't know if you're familiar with those, but it uses electromagnetic force to reduce inflammation in a joint. And I've been using it myself. There's a little loop called the Assisi loop that I've also been thinking about offering through the website as well. Just so many things I'm involved in. It's so hard to find the time to sit down and get this done. Sorry. Okay.
All right. What's your opinion about red light therapy versus laser, such as a photonic health?
Okay, well, I don't know what photonic health is. It's just, I think it's just a trade name or something. But red light has been shown through LEDs to have some benefit to the body, reducing pain. I know we're seeing it a lot in tanning parlors as well, where you have these red light booths that people can go into. Um, the story is that the red light helps, but apparently needs to be reapplied more frequently. The laser that I use, the multi-radiance laser, has both a laser and a red light, and they work best together. The laser is stronger, but red light could be helpful if you keep reapplying it every day. Because it doesn't last as long as the laser does. And I saw that Bruce Wayne is here, and that she mentioned that Bruce Wayne is using a PEMF mat as well. That's the pulse electromagnetic force. And how is Bruce Wayne doing? I know he didn't you recently have a diagnosis that was pretty challenging? Anyway, how are we doing on questions? Bring them on. We're here till we're done.
Oh yeah, here's one. Would there ever be a reason to apply mushrooms as a paste topically on lumps bumps when you're not sure what the bump is yet? Maybe by mixing it in MCT oil, or do mushrooms need to be ingested for them to work well?
Well, the beta glucans in mushrooms, which is what we know stimulate the immune system, have got to come in contact with immune cells in order for them to work. So if it's topical to a mass, it's unlikely that there are immune cells in the skin. Whether there's immune cells in the mass, don't know. That's why the beta glucans systemically, they're best ingested because they then encounter the immune cells in the tummy, which then travel around the body to do their work. But there are other ingredients in mushrooms. There's terpenes, which can have an anti-cancer property and could absorb through the mass to have some effect there. But again, I'm hearing you say you don't know what it is and you already want to treat it, and I really encourage you to find out what you got. Because maybe it's something that needs to be dealt with in a less casual fashion than putting a topical on it. You know, maybe it doesn't, and maybe it's something that it doesn't really need. Maybe your time, energy, and money is better spent working on other aspects of your pet's health than a lump that you don't know what it is and maybe isn't interfering with quality of life or anything else. So sometimes you have to look at those um, priorities. So there we go. And certainly we're at hour and a half now and going strong. And if you have questions, I'm here for you. What do we want? Did we want to give a discount code? I don't think we.
Yeah, yep, yep, yep. I did put it in the chat.
Okay.
But it is a DRL 12425. It's the date,
Oh, I see.
12/4/25. But I'll put it in there
DRL is
again.
Dr. Rob Live, huh?
Yeah. 12425.
Cool. Well, we appreciate you all coming tonight. If there's no more questions or conversation that you guys want to have, um, we'll see you. When is our next meeting?
So I have it. We don't have a topic set up yet for that, but I have it down for January 22nd.
Okay. That may not work actually. I'm
Oh,
speaking in um yeah. Oh, we do have it down. I see. Yeah, I'm coming home on the 21st, so yeah, I'll be able to do the 22nd. I'm speaking in Orlando at a big veterinary conference on that Tuesday, I guess. So yeah, we don't have a topic yet. And hey, if there's a topic you'd like us to cover, please reach out to us and suggest it because we're definitely open to finding topics that are of most interest to people.
and also there was Lily did have a question here. What do you recommend for dermatitis on the lip folds around the mouth?
I thought I answered that.
Yeah, I think it may have been missed.
I'm sorry?
It may have been missed.
No, that was where I talked about using a topical wipe.
Okay, that's right. That's right. Yeah, Lily, if you did miss that question, it was answered.
Okay, so yeah, my suggestion, Lily, was to, I mean, there's things we can do. I don't know all the details, but there's things that can be done to, with diet, with supplements. But ultimately, I think the simplest way to address it is to use a cleansing wipe, maybe an antiseptic wipe, and just clean them out on a regular basis. I think that's the simplest thing to do. Um, if your animal will allow you to do that. And maybe associate it with a treat or something so they look forward to your helping them reduce the inflammation in those skin folds around the mouth.
think think that will be all. We do have a somebody would like kidney disease and preventatives for a talk.
Okay, that's a good topic. I'm pretty knowledgeable about that, and we have some tools to use. So yeah, we could start going through different organ systems. We could do kidney one month, and maybe liver another month, and maybe talk about some neurologic conditions another month. We did epilepsy already, though, didn't we?
But that was a big one. Probably want to do that maybe.
We could do epilepsy again for
Mhm.
sure. And and we might want to do one on the microbiome as well. Speaking of epilepsy, seems like changing the microbiome can help with epilepsy as well. And as I'm taking this course on the microbiome, I'm also planning on doing some microbiome restorative therapy, which basically means fecal transplants. Ollie's going to get the first. I'll let you know how he does. But they say that if you can transfer the feces of a dog who has good mental health or lack of anxiety into a dog who has anxiety, oftentimes their behavior will change and they'll become less anxious because there's this brain-gut connection, and there's things about the actual microbiome that are in part creating the anxiety or in part contributing to the epilepsy. So I'm real curious about that, and I'll let you know as I learn more.